If you have Blue Cross Blue Shield, your prescription coverage is changing. The insurance company will no longer cover the cost of OxyContin. Desiree Wiley joins us now live from Blue Cross Blue Shield offices in West Nashville. Desiree, two questions. When does this change start? And what happens if you actually have a prescription that runs longer than the new deadline?
Well, Tom, the change will go into effect January 1st of 2019. So if someone has a pre-authorized prescription for OxyContin right now that extends past that January 1st deadline, they're okay. They can continue out that prescription. But for others, things are changing.
For the safety of our members, Blue Cross is implementing additional changes to the way that we cover opioids.
This will impact fully insured people who have Blue Cross through their employer and the Affordable Care Act. Cancer, hospice, and Medicare patients are excluded.
When their doctor files the prior authorization, they'll get an automatic approval.
Instead of OxyContin, 2 other abuse deterrent drugs will be offered, keeping your copay the same.
We're also putting in place an initial 7-day limit on a short-acting opioid prescription.
We're in the middle of a huge opioid epidemic right now.
Chad Clardy with Addiction Campuses says something needs to be done, but he's not sold on this change.
A lot of individuals that are already hooked on OxyContin are going to turn to different areas, calling drug dealers, and heroin is a much cheaper option.
According to the Tennessee Department of Health, more than 1,200 people died after overdosing on opioids last year. 644 were associated with prescription opioids.
Opioid addiction, it'll make you do things you don't want to do, take you places you don't want to go, and keep you there a lot longer than you want to stay.
And Blue Cross Blue Shield says that this decision didn't come without extensive research and support from doctors and other experts. The goal here is to curb the opioid epidemic and potentially save lives.